MAH stands for Major Autohemotherapy. An MAH is an IV where a small amount of blood is removed from the body, mixed with medical-grade ozone, and then reinfused back into the same patient. This is what it looks like. You can see that the blood going back in is much brighter red than when it's removed. This is because the blood has been superoxygenated with ozone. Ozone changes the blood formulation and helps the blood flow more efficiently. Anything that improves and maintains red blood cell health plays a significant role in maintaining harmonious bodily processes. The first of which is modulating the immune system, especially by serum cytokines, a type of protein that regulates immune responses. This means it can boost in times of illness or simmer down if it's overactive, as in autoimmune conditions. It does this by helping out the mitochondria. If you remember from my other videos, mitochondria dysfunction is correlated with metabolic diseases and every single mental illness. Studies confirm that ozone therapy alone, or as part of an integrative and complementary therapy, is beneficial for all mitochondria parameters in a variety of chronic and acute diseases where mitochondria dysfunction plays a central role, which is most of them. You know that anything that helps modulate the immune system and helps boost mitochondria function is going to positively affect every aspect of physical and mental life. Ozone helps the body efficiently combat viruses and bacteria by neutralizing toxins and directly killing microorganisms. Any procedure that is documented to fight oxidative stress is believed to also induce anti-cancer properties. Aside from increasing oxygen availability in the tissues, cancers can't survive in an oxygen-rich environment, an MAH also induces direct damage to tumor cells. A study in 2021 was conducted for 3 months on the effect of major AutoHemo on patients with fibromyalgia. Upon completion of the 13 sessions, a significant improvement in the quality of life and general health status were noted in all patients. A study noted that an MAH was responsible for a significant improvement in motor function in post-stroke patients. A more recent study in 2021 has further cemented the safety of major AutoHemo in rehabilitation programs. The application of MAH was effective in the treatment of patients with interstitial cystitis, which is bladder pain syndrome, in which nothing else worked. We already mentioned how ozone is one of the best microorganism killers. As such, it has antibacterial, antiviral, antifungal, and antiparasitic properties. It's also very effective against yeast like Candida, and it can inhibit the formation of hyphae. A study in 2018 looking at MAH's efficacy showed that after 1 year of conventional medical treatment, patients who then did 15 sessions of MAH therapy became negative for the hepatitis B surface antigen, were able to make hepatitis B antibodies, had liver enzymes levels return to normal, and showed a significant decrease in viral load. Patients with COVID-19 pneumonia enjoyed a reduction of lung inflammation, decreased time for assisted breathing measures, improved oxygen saturation, and a shorter duration of positive PCR tests. We all know that inflammation is correlated to almost every disease there is. MAH has been documented to decrease oxidative stress and thus decrease inflammation as a whole. In one study of people fighting antibiotic-resistant infections, MAH reduced inflammatory biomarkers by more than 75%, which translated into less bacterial sepsis, pain, discomfort, and musculoskeletal disability. Macular degeneration is one of the most common causes of vision loss as age increases, and MAH minimizes the depth of the photoreceptors, delaying the natural course of macular degeneration and subsequent vision loss. Since MAH plays an important role in mitigating inflammation and oxidative stress, multiple pieces of evidence conclude that for pain management it's similar and even superior to other more invasive treatments. It helped patients with pain from osteoarthritis, tendinopathies, shoulder problems, and even spinal problems. They even found MAH to help in the treatment of extreme health conditions like AIDS. Dr. John Pittman said, "I know of a number of cases of individuals with T-cell counts that have been very low, but because of regular ozone therapy, they have not gotten any opportunistic infections. In fact, it's almost as though the ozone is taking the place of their immune system. Unfortunately, you do not see the rises in their T-cell counts, but you see a stabilization and management as a chronic manageable illness. It's my belief that the use of ozone in association with other complementary therapies can convert AIDS from a uniformly terminal illness to something that is chronically manageable, which is better than what anyone else can offer at this point." Conclusion. Study after study confirms it's a wide-spectrum healer because anything that helps with the immune system and mitochondria function is going to help the entire body. If your immune system isn't working as it should, the effect of an MAH therapy sort of replaces the dysfunctioning parts of your immune system. And if your immune system is working as it should, it can provide a boost. As you can see, regular ozone therapy can help boost your immune system and increase the healing rate of your body. Quote, "It's just a basic therapy that will enhance every treatment mode afterwards." Schedule one today and experience for yourself the power of oxygenated ozone therapy. Many people do a treatment once a month to prevent common illness. Try a couple and experience how great you feel. To prepare for your treatment, arrive well hydrated and plan for staying for about an hour.